the Healthcare Committee. This is Dr. Sheri Belafsky. She is the Medical Director of Healthy Davis Together, and she's going to tell you what it is she does as part of that, which is awe-inspiring because there's so many hats that you wear there. We've met before. I'm Michelle Famula. I chair the League of Women Voters Davis Area Healthcare Committee, and I'm here in West Sacramento at the Satellite Vaccination Clinic for Healthy Davis Together. And working with Dr. Belafsky, I work as a volunteer providing clinical oversight to an incredible staff of nurses and student assistants, I guess, who are overseeing this operation, which is just incredible, and all under Sheri's guidance. So we're going to turn it over to Dr. Belafsky to explain to us Healthy Davis Together, whatever it is that you would like people to know about it.
Okay. So just a big thank you to you guys for the invitation, and thank you, Michelle, for all of your volunteering, because Michelle's been doing this since we opened, like the week we opened. So thank you. And also going out to migrant farms now, like on Tuesday nights, to meet people and do really, I think, the hardest work right now of the pandemic, which is talking to people and understanding what their hesitancy is around vaccines, because that's really, I think, the only way that we're going to move forward, is to understand where people are and try to meet them there with information and education. So thank you. May I share my screen? Is that okay?
Yes, of course.
So thank you again for the kind invitation. And I'm serving as medical director for Healthy Davis Together. My background is in public health and specifically preventive medicine. So I love this, just this quick overview of what HDT is doing. But essentially, Healthy Davis is a pretty special partnership between the City of Davis, UC Davis, Yolo County. And when the project started out, it definitely had a more Davis focus, and happily it's grown to support many, many projects and initiatives throughout the entire county, which feels great. I'm going, and what makes the project kind of unique is that its focus was to mitigate COVID's effects. And it has a multi-layered approach, as you can see, with a focus not just on testing and, say, contact tracing, but also on healthy behaviors. And yes, providing regular free testing is a big part of it, but there's also environmental monitoring and supporting local business. So I'm going to focus mostly on testing and vaccines, but I'll stray a little bit from there. And I know we have a formal Q&A at the end, but we're a small group, and I welcome your questions. If you want to jump in with a question at any point, feel free. So we started testing at 2 fixed sites back on November 18th. We are open at the Mondavi Center and the Senior Center. And since that time, till I think through the 29th, we have about 200,000 tests that we've done. And that's kind of staggering. There's about 223,000 people that live in Yolo County, just for some reference, but that's in 45,000 people. So we do have repeat testers. The testing is done with it's a saliva test that's PCR based, that's done right on campus at our Genome Center lab, which converted itself into a PCR testing lab for COVID. It was before that using its PCR skills for agricultural research, but they flipped themselves inside out to do this. And also what we have on site at the Mondavi Center is the ability to do a rapid antigen test. We have a nurse who can do nasal swabs. We can also do that for someone who's been exposed to or who has symptoms. So what did 200,000 tests uncover? About 1,500 positives. And most of those people were walking around thinking that, I'm asymptomatic, I'm fine. So it's pretty gratifying to see that, 1,500 people were paused and not circulating in the community. Yeah. Oh, and if we really want to flex, here's UC Davis's campus number. So the Genome Lab is processing thousands of tests every day, and they picked up a third of what we did, 556 tests, and they started testing probably in the summer from almost 400,000 tests. So that's students and staff.
I have a quick question. For the rapid testing, what qualifies someone to do the over the saliva testing? What qualifies someone to do the rapid testing?
So we wanted to keep the lines separate. We wanted to have people with symptoms in a separate place.
Got it.
Right. So that provider would wear the appropriate PPE, including an N95. So you qualify if you had symptoms, or if you had a really good story for an exposure, like my family member is positive. We're like, okay, you can get a rapid test.
And do people access that testing site like through the Healthy Davis Together? Like, is it from the questionnaire?
You can just show up at the Mondavi Center.
Okay.
You make an appointment, but most people just show up, and then the greeter will direct them to the line if they have symptoms. Yeah. Mm-hmm.
Thank you.
And one more little piece about that's kind of interesting is that if someone has a negative rapid test, we'll then go ahead and give them a saliva test outside as well. And also encourage them to come back if they need to.
I also have a question because I noticed of those that you tested, that there were 18 that had been fully vaccinated.
Yes.
Did they do follow-up work with them? Because there are some false positives, are there not, with the saliva testing?
Well, our false positive rate is extremely low. The Genome Center lab director wanted, that was a really like a high priority for him, right? He wanted obviously a very sensitive test, but he thought the stakes were high to pull people off work and pull them out of circulation for a couple of weeks. So positives are repeated. And if unless they're at a certain like CT value, they are will be called like indeterminate, and people will be encouraged to retest. But the false positive rate is pretty low, near zero.
So is there any concern about them passing the virus?
Oh, absolutely. Yeah.
Okay.
Those 18 people, we would call those vaccine breakthrough. Yes, many of them have symptoms. Absolutely, yes.
But they did show symptoms.
Oh, yes.
Oh.
Vaccine breakthrough is real. And remember that we're calling them afterward. So we'll hear if they've developed symptoms.
Gotcha.
So they may have had, I have a headache, or I just felt kind of off. And by the time we speak to them 12 hours later or 24 hours later, they have a whole bunch of symptoms.
Got it.
John Lee, did you have something you wanted to add?
Excuse me?
Did you have something?
Yeah, there was one case, I believe in California, of a nursing home where 13 people who had been vaccinated had positive, not reactions. They got the symptoms of somebody brought in the coronavirus, and their immune system couldn't fight it. 2 of those people passed away from that. So my only point is, it's not 100%. It's incredible that it's 90% when they started with a standard of 70%.
Right.
But it's not 100%. And people are still expecting steel precision from biological medicine. And it's not possible.
Right.
What you're going to say today is the very best thing you can possibly say. And tomorrow you're going to say that wasn't good enough because now I have new information. And that's the best we can do. And you're learning more every day.
I think.
Thank you. Go ahead.
Yeah. Okay, so this is kind of a fun slide because you get to see what things looked like back in January when they were peaking. This was Merry Christmas to you, or the fallout from Merry Christmas. And we had probably peaking on like January 6th. and then a really lovely steady progression of case positivity downward. What you can see, though, is an interesting little spike, and I'll leave it as a cliffhanger. I'll get back to that later, but that is late April. And then this is just last week. So we're not at zero. We've had some days with zeros, but then we pop back up. So case positivity remains quite low right now, but we're still seeing cases. This is also a fun slide, I think, because we really get to see how well Yolo County and the Davis community is doing, like relative to the state of California. So solid line, that's the state of California. Trends are the same, right? We see that, but that's Yolo County below it, and here's Davis down here. So with our blip in April, but really staying like quite low, and great to see the county also well below what the state's doing. Down here, which is so negligible, is the UC Davis campus, which is great with their mandatory testing. I would say some takeaways really is that we saw how many, almost like 1,500 people who were mostly asymptomatic were picked up with our testing. We started case investigating in January, and it's in partnership with Yolo County. And what it does is give us a real leg up on, I would say, traditional case investigation, which can often take 5 days or sometimes even a week to get started. And by then you can imagine the horse might be out of the barn. Right? You've missed an opportunity to reach out to contacts, and they might themselves then be out in the community. So by training our own case investigators to the same level that county case investigators were trained and entering into a partnership with them, we were able to begin case investigation on our positives most of the time within about 12 hours of the cases being identified.
What does case investigation look like? I guess just like a brief overview of that.
Yeah, absolutely. So we hired graduate students, mostly in public health, and sent them to a virtual training academy at UCLA. That's what the county standard was, and that's what most public health officials were requesting at that time. And they went through a rigorous training. I think it was about 25 hours. And when they get, I'll back it up from the lab, and I'll walk you guys through what happens. So the Genome Center lab will generate the positive results, and those results are fed into our electronic health record. That has been linked to the state's reporting system called CalReady. We send up our positive results to them. At the same time, our results team, one of our nurses or mid-levels, or sometimes me, calls the positive case, walks them through it, makes sure they're doing okay, that they don't need to go to the hospital, they don't need any special resources or care, and if they do, we have some great connections for them. But so after we kind of just check in with them on the result side, within probably by the next morning, we have our case coordinator who is able to access all the cases that have been generated and by the state software system, and look for the ones from Healthy Davis Together and prioritize those for our group of case investigators. She then would assign them based on their availability, and the case investigator would call the positive case and go through what could probably be like an hour-long conversation about where they've been, who they've been with, what kind of symptoms they have had, where do they work, are they in a school or a congregate facility, and then the next step to that would be if they identify contacts, people they've had close contact with, the investigators would open up contact tracing investigations for those people and reach out to them. So we started out with 2 fixed sites. That was the Mondavi Center and Davis Senior Center, and we quickly grew to 4 locations in Davis. But then what happened was, as cases were spiking, the county reached out to us and asked if we could help the long-term care facilities. And kind of like as John Lee mentioned earlier, those were places with a lot of vulnerability, a lot of cases happening. And unfortunately in our county, that's the majority of where we had our greatest fatalities. So the county had mandated twice weekly testing for staff at the facilities. And what we set up for them was a courier model where we were able to drop off and pick up the supplies so they could do their testing on site. We trained them how to do it. They did their own testing, we could pick it up. So we did this then for many, many entities throughout the county, 32 of them in fact. And then our testing sites have multiplied and multiplied as the Davis School District came online, and when they opened back up this spring, and then Woodland Schools opened back up. So right now we've got 19 testing sites and 32 of these courier sites as well. So back at the end of March, we got to like have a glimpse of what the impact, one of the impacts of our work was, in that we, Yolo County got to move out of the red tier and into the orange, less restrictive tier, because we could add all these asymptomatic cases, or I should say asymptomatic testing to the county's existing numbers. So what we really did was able to like boost the county, and so that had positive impact, right, for the businesses and for I guess for residents. Yeah. So what's happening next? As people are getting vaccinated, we see like a decrease in demand for testing. The CDC's guidance also drives that. In recommending that people who have been vaccinated, they don't need to be tested only if they develop symptoms. We haven't always aligned with that guidance, in that we thought if people are exposed, probably recommend that they should still get tested, but the CDC was recommending otherwise, and CDPH soon followed suit. So we are supporting the county, and in alignment with CDPH, we are really encouraging those who have not been vaccinated to get tested. So that gives us a focus on particularly on younger kids. I will point out that, you know, over half our county is not fully vaccinated. So there's still plenty of people who do need regular asymptomatic testing, or for when they're exposed. So our model is going to be doing a lot of prepping and planning for county schools. Some of them will have summer school programs, and we'll be doing testing there, and then mostly getting ready for August when they reopen, with a focus on the elementary and junior high. Mondavi is going to stay open as it is right now, continuing to have that option for symptomatic testing on site with a nurse. But then 2 of our fixed sites, Senior Center and the Vets Memorial Center in Davis, we're going to close those and replace them with neighborhood sites that are spread out, that cover the city. So we'll take advantage of our partnership with the Davis school sites, and those who are hosting summer school sessions will be piggybacking on those sites and offering them to the whole community.
Fantastic.
And that was like a testing in a nutshell.
Excuse me?
Yeah.
Excuse me?
Yes.
Can I say something?
Yeah.
Okay, so just so you understand, that's what I think we should do with the entire healthcare delivery system. I think we should divide Davis into 11 communities of 4,000 to 10,000 people. And each community should have a clinic. So there should be 10 clinics in Davis, and that should be 85% of the healthcare that we give in Davis, not in hospitals. That's what I think we should do with healthcare in the 21st century. What we're doing now does not work. I'm at the end of my sermon. Go ahead.
Okay, thank you. Moving on to vaccines at the end of the sermon. I'm going to speed through this information, but basically we were surveying and looking at sentiments about basically beliefs about vaccines, and you know, about half of the county residents, and this was not this was a survey of about 1,000 people, but about half of them felt like they were safe and effective. And interesting that back then in February that 61% of respondents thought they were likely to get vaccinated. Remember that number. Okay. So Healthy Davis together decided to focus its efforts on the underserved residents of Yolo County. We saw that Yolo County itself, as well as the private healthcare entities, they seem to be taking very good care of people who had insurance and people who had access to technology. So we wanted to support those who did not. And we did that through a variety of techniques, and some of them more traditional, like what you're seeing to your right. Those are some graphics, flyers that we created for the county or some of the community-based organizations that we support. And those are really aimed at people who were already interested in vaccines and just needed information, just needed maybe the access. And then we did some other things that were maybe a bit more novel. So first, we partnered with CommuniCare, and CommuniCare, I'm sure you guys are familiar with it. It's a federally qualified health center, serves about 30 to 35,000 folks in the county who are either uninsured or eligible for Medi-Cal. And we chose our 2 clinic locations based on California Healthy Places Index data, the lowest quartile data. So we chose a location in West Sacramento and Woodland based on that. And we have also simultaneously been utilizing some of our nursing staff to go out and do some mobile work in conjunction with the county. For example, like for migrant workers or farm workers. So it's fun to call the telephone something innovative. Like, you know, things have really changed when this is an innovation. But if you think about it, most COVID vaccine appointments were being generated through like online sources. And what we were learning from our partners at CommuniCare was that that was not really working at all for their patient population. So what we did was put together a call center pretty quickly, and which was pretty amazing, since we asked kiosk workers who were collecting saliva samples if they would like to be part of a call center, and 6 of them said they would. And we were able to generate quite a number of appointments. I guess this was data from last month. So by the end of May, we maybe got about 4,500 appointments just from using the call center. We also hired staff who Spanish speaking, Russian speaking, and we also use a language line for interpretation services when people don't speak one of those 2 languages. One of our partners, Sutter Health, was able to offer a grant to CommuniCare to use Uber Health to give rides, and that was another way that we addressed transportation barriers. And then it's funny also to think of like innovation by being flexible, but I don't think that medical providers are known for our flexibility. This may be why I'm experiencing this as innovative, but we learned very quickly from, you know, feedback from our patients, from actually surveying our patients, from call center data, when people were not able to schedule appointments, that our population was really essential workers. Or maybe they were the family members of essential workers, so they were depending on them. So we needed evening hours and we needed Saturdays. So we did that. We made some changes. And then more recently, some of the most high touch efforts that we've been working with have been actually some door-to-door efforts. So in conjunction with the county's homeless coordinator, our mobile vaccine team has gone door-to-door with our, gotta love the portable fridge. And they're going door to door at motels along West Capitol Avenue, where there are a lot of folks who kind of move in and out of homelessness, depending on the time of month and what their resources are like. And we've done about 50 vaccines that way. And we have school vaccines that we've been doing now in West Sacramento. In fact, this week we're back for 2nd doses at 3 different schools there, and many more are planned. We also have pop-up events planned. A lot of this is relying on the information that we're getting from our partners who are community-based organizations. So they're the ones who are guiding us. This is the right park. This is the right apartment complex. And that's what we're going to be moving to. I would say a mostly mobile focus over the next few months. That last bullet point about having clinicians on site to answer questions, feel free to ask Dr. Famula all the questions you want during the Q&A, and she can share with you what it's like to be on site at the migrant worker camp, where we're really trying to encourage people to take the chance and, connect with Dr. Famula. They're going to see her familiar face week after week. So hopefully they'll feel comfortable and will maybe open up and be able to ask those questions that are hard to ask. And that's what I would say is the biggest part of our efforts right now is in this outreach work is really trying to understand the questions that people have and be able to provide them with information, scientific information. So that's what people really want. They want really I would say very meaty responses. I've been so impressed at the thoughtful questions that we get from our patients and even from our community-based organization employees. Okay, what else? Okay, so here's the little wrap up. As of yesterday, we had administered over 10,000 vaccines, and the part that we're of course very excited about is that our communities, our vaccines are really getting to those that we wanted to reach, with 45% going into those who identify as Latinx. Kind of fun. Fun fact, 61% of county residents have at least their first dose, which I just thought was really kind of a fun, that it was exactly the same number of people who had expressed interest back in February. We're hoping that we'll do more than that, right? We're hoping to boost those numbers, but that's where we are at the moment, or as of a week or so ago. And then this is as of yesterday, just a quick look at some of the ethnicity data. And you can see that our people who identify as white are making up just a very small fraction of our total doses given, 2,300 out of about 10,000. Okay, so I promised I had a couple of other little tidbits to share with you, but just to really let you know some of the other fun things that Healthy Davis Together is doing. I'm not sure if you guys are aware, but we have been partnering with the City of Davis to do wastewater monitoring. And these are being done, samplings being done all over the city, and the results are analyzed in the campus lab and then updated on our website weekly. So anybody is welcome to look at the data at any time. If and when we see sustained positivity that's concerning, we have the ability to contact a very specific neighborhood, and we have done that through the city and encourage people to go get testing, say, hey, this is what we're seeing. So that is potentially a really great use of Sentinel wastewater monitoring. And then lastly, I don't know if any of you stress about variants, but just to let you know, the Genome Center lab is not just good at doing saliva tests. They're also decided in January, hey, variants are worrying us. So we're going to quickly learn how we can do genotyping on them. And you can see the B117 is the, all the way on the left, this is the variant that was formerly referred to as the UK variant. We've moved now to alpha, beta, different ways of assigning names to them. And you can see that's been present since we started looking. But then fun, when you come down to April 25th, which corresponds to our spike, by the way, and we see 30. Oopsie, I'm going back for a second. I need to move this out of my way for a second, all of you, so I can see out of our total 30 out of 42 positives that week we could have been attributed to the alpha variant. So just kind of interesting information. And also variants of interest, which are not at the same level of variants of concern, but means that CDC is watching. These are formerly known as New York, India. And you can see where they're really showing up here, most recently. Yeah. Okay. So lastly, I would just want to, maybe not, there we go. Just give a shout out to our partners. We have more partners than what I'm showing here, but really Communicare and the County of Yolo have been incredible partners, and just a big shout out to them. Okay. So thank you for your great questions so far, and happy to answer others if I can.
Thank you for.
Yes, thank you so much. This is so great. This information's been really, really helpful and great. I have one quick question. You know how there was a spike going downwards, the downwards trend for the City of Davis and UC Davis? But now that more people are getting vaccinated, isn't the number of people who are getting tested, just hasn't that dropped kind of exponentially? Because the first, after I got my vaccines, the first 3 weeks I was still going in, and then I was just like, nope, I think I'm good.
So something really fun, I'm like, I need another graph to show you, but it's kind of like, so yes, we haven't seen a precipitous like tanking of our population from testing, but you're right, we're seeing like a trending downward. But here's what's been happening. School children are getting tested.
Mm-hmm.
So our overall numbers are not actually that different. We're still testing over like 1,000 a day.
Great.
Yeah.
Awesome.
So, and you're right, we expect that adults will do less testing, and that's probably pretty normal. Yeah.
And I guess another question, I'm just going to keep asking all the questions I have till someone else pipes up. What are your, like, the biggest challenges that you're seeing in regards to vaccine hesitancy? Like, what are people, is it the media that's kind of like in the past, that's been kind of, in the last 4 years, things have changed a lot for science and facts. So,
Yeah. It's really interesting. And Michelle, feel free to jump in here. But I would say that one of the things that surprises me the most is like how many different forms of hesitancy there are. And you may have seen recently in the media, like, someone breaks it into 4 groups. So there's 4 types of hesitancy. There's 5. So there's a lot of ways of looking at people, and some people who are just kind of like, who feel like, say 30 to 34-year-olds, if you guys have saw the Enterprise like today, have like in Yolo County, a super low rate. I think the lowest of any group. It's like 31 or 32% of them are vaccinated, and we call them the young invincibles.
that's my group. But I'm fully vaccinated. I'm fully vaccinated.
Well,
Oh, no.
I don't know if you have peers,
Mhm.
friends, people you've heard talking, that it's not a lack of appreciation for the science or like a lack of care for other people. It just doesn't feel that relevant.
Mhm.
That, right? It's just like, oh yeah, that's probably something I should do,
Yeah.
but it doesn't hit home.
Mhm.
And then there are people who have religious beliefs, right? There are like people who are Catholic, who are very concerned about the use of fetal cells at any point in the research history. So if it had been, like in progenitors of the vaccine or that type of vaccine, they're like not interested. So, so there's that.
Mhm.
And then you're right, there's a lot of mythology that's floating around. And I think that, you're right, science did take a beating in the past, several years. And I think it's, that's one of the things that we see is like a lot of mythology. So one of the ways that we're addressing it is we've created a document of mythology and have like the scientific responses to them, and we'll share it
Mhm.
with anybody who's interested or asks those questions. And then there are, I would say there are some like people who are very, I would say maybe more conspiracy theorists. So not even those who doubt science, but I've had people, ask me, is there a magnet in there? And I've encouraged them to come on site to exactly where Michelle is, across the room from her, where the nurses are drawing up doses. I'm like, you're welcome to look. You can pull up a chair and just watch. And if you need to kind of see what it looks like, but people are afraid that there's literally contaminants in the doses. Michelle, you look like you.
Yeah, I was just going to say that my experience yesterday talking with folks at the Davis Migrant Center, I thought overall was pretty positive. Most of the folks who'd received the vaccine said they would recommend it to others. But when asked, do you have any questions? They were very happy to ask their questions. Some of them were things that they had heard on the TV or they'd heard from other people. It wasn't so much at all argumentative, but it was just, well, I've heard this. What do you think about this? One gentleman said, I said, so which vaccine did you get? And he said, oh, I got the one that kills people. I said, I'm sorry, what? And he said, well, I got the Johnson & Johnson. That's the one that kills people. And I said, oh, do you know anyone who's died after receiving the Johnson & Johnson? He goes, oh, no, not at all. But I heard it on the TV. And so we had a conversation about that as well. And, you know, to the point where we were even talking about the fact that I'm certain that there are people, because so many were elderly and had chronic medical problems, that in the last 6 months after having had their vaccine, they've passed. It won't make you immortal, you know. And you know, in general, we study these things, and no, it's not a lethal vaccine. And he said I would recommend it to other people. I haven't gotten COVID, and I think that's why, you know. So I mean, it is good to have that conversation, you know.
Yeah, yeah. So I really feel like if there was, you know, like a call to action, no pressure, League of Women Voters, but if there was something that you guys, some messaging that you wanted to get out there, I would say that it's really to ask, to engage, you know, people with their concerns. And I think that conversation is one of the best ways to help people, like, you know, get their questions answered, and maybe they'll find their way towards the movable middle, and then be ready to make that decision to proceed with a vaccine.
No, that's great. I also really appreciate that you guys are being so transparent. I think that also helps the conversation. Like having them sit and see the nurses draw their vaccine. I think that's great. I think I'll just assuage some fears anyway. So
We
that's
really
really great.
encourage people to ask questions. Yeah.
Sheri, and I was very interested in the fact that you'd said you've prepared, because you do have all of these variations, and everybody's individual in terms of why it is they hesitate or don't want to take the vaccine. But it might be useful to, you know, like the one with the myths, you know, and the counter, you know, the information one can get, if you would be willing to share those with the committee, where we would have them. I'm a retired nurse. Linda, are you a retired nurse too?
No.
No, you're not. Okay, because I was, but we do have other healthcare retirees, you know, as part of this. But and it probably, you know, you don't have to be from the medical field to be able to use those explanations.
Yeah. Michelle, I think you have a copy of it. Would you feel comfortable sharing it? Or
Which is this? I'm sorry, a
It's the
copy of it,
myth-
what?
the
Oh,
myth-
the myths.
Yeah.
Yes, I definitely would. That would be fine. And if it's okay with you, we would be happy to promote it through our website and through our committee. Sure, that would be great. Thank you.
Just to let everyone know, you can just hover your cursor over it, and they're hyperlinks. So the answers will take you to the scientific references.
Oh, lovely.
Yeah, it's a pretty cool document. Well, I can't thank you enough for joining us this evening. This has been really enlightening, and thank you so much for such a thorough presentation. I don't think we were expecting all that energy. So so it was really great. Thank you very much. And I think, unless anybody has final words, I think in the interest in time and being respectful of your time, I think that will draw our committee meeting to a close. What do you think, folks?
Yes,